All right, so in this part of the presentation, we're going to be looking at the joints and the muscles involved in the lower leg, ankle, and foot. So there's very specific joints along with functions here, particularly at the ankle complex itself, because we have movements that kind of take place within the ankle but don't necessarily occur at the ankle joint. So be mindful of that as we're kind of going through these different regions. Okay, so the first joints we're going to look at the tibiofibular joints. So you really have two tibiofibular joints. You have a superior tibiofibular joint, you can see that right here, and then you have a distal tibiofibular joint. So obviously this is the one down here that's going to impact the function of the ankle. And again, that's where we talked about when you hear the term high ankle sprain, that's where the sprain takes place. Okay, that's the more serious of the sprains, and the reason why it's so serious is because this kind of forms the superior part of the ankle joint, and it makes it much more unstable when that area gets damaged. You also have the strong, dense interosseous membrane. It's not pictured here, but basically what it is, it's just a big soft tissue structure that sits in between the two bones. Okay, and as I said, injury to this area is called a high ankle sprain, and depending upon how high up it goes into the leg dictates essentially the severity of it. So you'll get lower grade high ankle sprains where just this down here is disrupted, but you can get sprains where it actually disrupts higher up into the leg. There's more serious injuries that can occur where you get a complete tear of the syndesmosis plus fractures at the fibula and tibia as well. Okay, the talocrural joint, or what is classically also known as the ankle joint. So the talocrural joint is the ankle joint. It is a hinge joint, okay? It's comprised of the talus, the distal tibia, and distal fibula, okay? So the talocrural joint is right there, so right where that green line comes in. So that's the actual ankle joint itself, okay? So talocrural, ankle joint both mean the same thing. So there you're going to have specific movements take place as far as when you're looking at the overall ankle motion. So here are your motions that take place at the talocrural joint. So the motion of dorsiflexion, which is also essentially flexion, okay, if you see here, okay, basically the ankle coming up, okay, the top of the foot and the ankle moving towards the anterior tibia, so this area in here, it's approximating, okay, that's dorsiflexion or flexion. Down here, you have plantar flexion, or what's also known as ankle extension, and that's movement of the ankle and foot away from the tibia. So those specific motions actually occur at the ankle joint or the talocrural joint. Okay, next you have the subtalar joint. So this is the joint that settles in and is beneath the talus. Okay, so it's the joint beneath the talus. So if you're looking here, we're actually looking at a medial shot of the inside of the foot and ankle, okay? So think about what all of these structures are here, what we're looking at, okay? So right now, what are these different structures? Think of them to yourself. Okay, so we'll start with this one right here. So what's this structure right here? If we're looking at a medial view of the ankle joint. Okay, that would be the tibia. What's this? Be the talus. That'd be the calcaneus. This would be the navicular right here. That'd be the first cuneiform. And that's the first metatarsal. Okay. So if you had trouble with that, again, you should be, when you should be reading this stuff prior to them asking questions like that, you should be able to answer them. Here we're focused on the subtalar joint, but you should be looking at these other anatomical structures and being able to name them. Okay, so these are the motions of the subtalar joint. So the motions of eversion, or the ankle and foot turning outward, or abducting away from the midline, and the motion of inversion. So when you look at inversion, so inversion right here, this is inversion, the foot turning in, okay? That's the most common mechanism for what's called a lateral ankle spring, okay? Now, the motions of inversion and eversion actually don't occur at the actual ankle joint, okay? You'll sometimes hear them referred to as ankle motions, and certainly there's movement that's taking place at the ankle. But in reality, both of these motions actually occur at the subtalar joint. They occur at that joint that exists underneath the talus, between the talus and the calcaneus. Okay, here's the different joints in the foot. Now again, much like the wrist and hand, and some people had a lot of trouble with this when we did the wrist and hand, and it's going to be the same thing here. Again, you have to orientate and break down, and this is where a lot of people had trouble. A lot of people had trouble in the wrist and hand differentiating between the phalanx bones and the metacarpals, okay? So again, we're going to look here. So we have the interphalangeal joints. We have a DIP and a PIP, much like in the hand at the first, okay, so like we had in the thumb, with the great toe, we don't have a DIP and a PIP. We only have an IP, okay? So here's the proximal phalanx, the distal phalanx. This is your big toe. In all the other four lateral toes, you have a PIP and a DIP. So here's the PIP of the second toe, okay? Or the second phalange, if you will, okay? Here's the DIP, okay? These are the metatarsals, okay? So here is the metatarsal phalangeal joints, okay? Down here, you have the tarsometatarsal joints. It's the articulation between the metatarsals and the tarsal bones, okay? So these are your tarsal bones. These are your metatarsals, and then your phalanges, your phalanx bones up here at your toes. So here we're pointing these out again. There's your DIP and PIP. There's your metatarsal phalangeal, and there's your tarsometatarsal. Okay, toe movement, again, much like the fingers, you're going to have flexion, movement of the toes towards the plantar surface. You have toe extension, okay? And all of these motions occur at the MTP, DIP, and PIP, or in the case of the great toe, at the IP joint, okay? So you have flexion of the toes, extension of the toes, so all those motions are going to occur at each one of those individual joints. Okay, so now that takes us to the muscles. So we're going to look at some muscles, talk about their functions. Again, make sure you're noting all of the specific origin and insertion of all of these different muscles as we're kind of covering all of the different muscles. So the first thing you should be thinking about when you're looking, again, just logically think where the muscles would be located that perform these individual actions. Okay, so if we look across, this represents all the actions we talked about. Okay, here's plantar flexion, dorsiflexion, eversion, inversion, toe extension, toe flexion. Okay, so just in general, where would these muscles be located? Okay, so there's ways you can group this stuff. Okay, so just think logically, and we're going to show you on the next slide where it would be. But for instance, if I just asked you, where's the general location of the muscles that produce plantar flexion, so the toes pointing down, what would it be? Where would it be? Be on the posterior side, right? So you're going to get shortening here. It's going to cause plantar flexion. Okay. Again, group according to location and function. Okay, so again, where you can kind of group things, it'll help you remember things a lot easier. So the anterior lower leg, ankle, and foot are going to be your dorsiflexors and your phalange extensors, okay, or your toe extensors. They're going to be in the anterior lower leg, ankle, and foot. Posterior lower leg, ankle, and foot. It's going to be your plantar flexors and your phalange flexors. Okay, so again, as we're going through these individual muscles, be making note of these general locations and how they match up with the function that they do. Lateral lower leg, ankle, and foot, going to be primarily your everters. Okay, and then obviously the medial lower leg, ankle, and foot are going to be your inverters. Okay, so your general location of some of this stuff is going to dictate what their function is, just like it would anywhere else in the body. Now in the lower leg, you actually have compartments, okay? So there's compartments in the lower leg. Basically what you have is there's 4 compartments, and what's going to happen is dense fascia surrounds and separates the compartments. So if you remember, we talked at the beginning of the year about what fascia is. Fascia is basically a soft tissue structure that surrounds our entire body, okay? It's sort of, people refer to it as the saran wrap of the body, okay? So everyone knows what saran wrap is. Well, essentially that's what fascia is. Well, in our lower leg, we have these compartments, okay? We have an anterior compartment, and if you look at what the anterior compartment consists of muscles that dorsiflex, invert, evert, and extend the toes, okay? There's specific muscles that lie within that anterior compartment. You have your lateral compartment. Those muscles plantar flex and evert the foot. And then you have your posterior compartment, which consists of a superficial and deep, okay? And you can see some of the muscle actions that take place there. So these muscles in these individual compartments are kind of bound within there, and there's also arteries and nerves that pass through there as well. And what this does, it helps to facilitate venous return while you're exercising. So hopefully what you end up with is no swelling in your lower leg. Now, what some individuals actually sometimes develop is something called compartment syndrome. So compartment syndrome is actually a chronic condition that some individuals get. You can actually get an acute compartment syndrome, which is actually a medical emergency. But in the chronic compartment syndrome, for whatever reason, individuals have really thick, tight fascia, and that pressure actually builds up to where they basically can't exercise or run because the pressure builds up so much in the compartments it actually causes a lot of pain and discomfort. In the case of an acute compartment syndrome, usually there's some type of traumatic injury to the lower leg, a fracture or something of that sort, and the compartment can't accommodate for the swelling. That's actually a medical emergency because the individual could it could go as far as the person losing their leg if it's not dealt with in a prompt fashion. Okay, so the muscles in the anterior compartment. So here's all the muscles in the anterior compartment along with their origin, insertion, and action. Okay, so you have the tibialis anterior, the anterior tibialis, the extensor hallucis longus, and the extensor digitorum longus. Okay, so you see the origin insertion up there. You're also noting what type of movement that they have. I'm going to have some pictures on the next slide. I kind of organized these in this fashion because I felt that, the compartments in the lower leg are kind of important. So if we have to learn the muscles in the compartment, we may as well just learn what they are and learn their origin, insertion, and action with them. So the tib anterior, and you can see the actions of each one of these. So pay note of this, and then we'll look at some pictures on the next slide. Okay, so here's the 3 muscles we just looked at. You can see the tibialis anterior. So the tibialis anterior is over here. The extensor digitorum longus. So now again, think of the origin and insertion as we talked about in the previous slide, and then here is the extensor hallucis. Okay, here's the muscles in the lateral compartment. You have the peroneus longus and the peroneus brevis. Okay, so you note again origin and insertion. You can see that both of these are everters. They also perform plantar flexion. Okay, so because of the way they kind of travel along the foot, they will also perform plantar flexion as well. So here you see the peroneus longus and brevis. So here's the peroneus longus right here. You can see it's the muscle belly sits a little higher, and it actually comes underneath the foot. Okay, the tendon actually comes around and runs underneath the foot. Okay, the peroneus brevis comes, again, it also comes along the lateral malleolus, and then it inserts right at the base of the fifth. So if you look over here, okay, you can see the peroneus brevis here, and then the peroneus longus, you can't see the end of it because it kind of wraps around here and then goes underneath the foot, okay, and then you can see how it kind of comes across in this here. So this isn't representative of being on the top of the foot. It actually wraps underneath the bottom of the foot and comes around to a more medial aspect. So it actually comes all the way around there, which is how it assists with plantar flexion. Here's the muscles in the superficial posterior compartment. So you have the soleus, the gastrocnemius, the plantaris, and the gastrocnemius. Okay. Now you notice here the gastrocnemius also does weak knee flexion. The gastrocnemius is actually a two-joint muscle. Now it's a two-joint muscle that crosses the ankle and the knee. Okay, and its function at the knee is that of a weak knee flexor. So it does produce some weak flexion at the knee, but all these other muscles are going to be responsible for performing plantar flexion. So here's the gastrocnemius and soleus, so what we commonly think of as the calf muscle. Okay, you can see the gastrocnemius and soleus, how they both come down through the Achilles tendon. So the Achilles tendon is this big structure here on the back of the heel. Both of them go through that. Okay, the soleus is a much deeper muscle. The soleus does not cross the knee joint. Okay, the gastrocnemius does. The gastrocnemius crosses the knee joint and will influence knee joint motion. And then here's the muscles in the deep posterior compartment. So you have the tibialis posterior, you have the flexor digitorum longus, and you have the flexor hallucis longus. Okay, and you can see the origin and insertions on here. So the posterior tibialis is going to plantar flex and invert. The flexor digitorum longus is going to do flexion of the second through fifth, MP, PIP, and DIP. It's also going to contribute to inversion and plantar flexion. And then the flexor hallucis longus is going to flex the first, MP, and IP, and also assist with plantar flexion inversion of the ankle. Okay, and here you can see some of these. So here they're showing the anterior tibialis just for some reference, but you can see the tib posterior on here as well. And you can also see in here, if you look in they're showing you the medial aspect of the ankle here in some of these tendons. So here's the tib posterior. Here's the flexor digitorum. So this is an important anatomical region for just, when we're looking at injuries in the ankle and foot. Okay, so this is the medial ankle region where you have these three tendons kind of coming along here. You can get some issues with a nerve that runs through here as well. So knowing this region is going to be obviously very important for that region. You can see how those tendons wrap around the medial malleolus. Okay, so that's the end of the ankle, foot, and lower leg. One thing I do want to say, so I'm gonna add another discussion board question. So what I want you to go back and do in the discussion board, okay? So this is part 3 of this discussion. I want you to go into the discussion board and outline. I want you to put the 3 compartments, okay? The compartments of the 4 compartments of the lower leg, because we have 2 in the posterior. And I just want you to, all I want you to do in the discussion board is put all the muscles in the anterior, the lateral, and the superficial and deep posterior compartments. Okay, so So that will be the other discussion board post that I want completed for this section. So it's important as I'm giving these to pay attention and make sure that you post in the discussion boards when I assign that.